Have you ever felt a strange burning pain in your stomach and brushed it off as just heartburn? What if I told you that pain could be a warning sign of something much more dangerous? An open wound, slowly eating away at your insides. Most people ignore the early signs of ulcers until it's too late. And by then, the damage might already be done. In today's video, we're exposing the hidden danger behind stomach ulcers, the overlooked symptoms, the real causes, and what could happen if you don't take action early. Ulcers aren't just a minor discomfort, they can turn deadly. Ulcers form when the protective lining of the stomach or small intestine is worn down, allowing acid to damage the underlying tissue. The stomach naturally produces hydrochloric acid to help digest food and also secretes mucus to protect its lining. When this balance is disturbed, either through excess acid or insufficient mucus, ulcers begin to develop. One of the most common causes is Helicobacter pylori, H. pylori, a bacterium that infects the stomach lining. It causes chronic inflammation and gradually weakens the mucosal barrier. Alarmingly, H. pylori infections can be asymptomatic for years. By the time pain is felt, the ulcer may already be well established. Another major cause is the overuse of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, and naproxen. These medications decrease the body's production of prostaglandins, compounds that protect the stomach lining. Regular use of NSAIDs, especially on an empty stomach, greatly increases the risk of gastric ulcers. Stress, once believed to be a direct cause, doesn't create ulcers, but can worsen them by affecting digestion and acid levels. Certain lifestyle choices also raise the risk. Smoking restricts blood flow to the stomach lining, impairing healing. Alcohol boosts acid production and damages the mucosal layer. A poor diet can contribute to a weakened stomach environment. When combined with bacterial infection or medication use, these factors create a perfect storm for ulcer formation. Another major cause is the overuse of non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, aspirin, and naproxen. These medications decrease the body's production of prostaglandins, compounds that protect the stomach lining. Regular use of NSAIDs, especially on an empty stomach, greatly increases the risk of gastric ulcers. Stress, once believed to be a direct cause, doesn't create ulcers, but can worsen them by affecting digestion and acid levels. Certain lifestyle choices also raise the risk. Smoking restricts blood flow to the stomach lining, impairing healing. Alcohol boosts acid production and damages the mucosal layer. A poor diet can contribute to a weakened stomach environment. When combined with bacterial infection or medication use, these factors create a perfect storm for ulcer formation. Signs and symptoms of ulcers. Ulcers often don't cause immediate pain. In fact, many go unnoticed for months or even years. When symptoms do arise, they can resemble other conditions, causing people to self-treat or ignore them. The most common symptom is a burning or gnawing pain in the upper abdomen, often felt between meals or at night. While this pain may be temporarily relieved by eating or taking antacids, it tends to return, sometimes more intensely. If the ulcer is in the duodenum, the first part of the small intestine, the pain may come a few hours after eating and improve with food. If the ulcer is in the stomach, eating may actually make the pain worse. Other warning signs include bloating, frequent burping, loss of appetite, unexplained weight loss. In more severe cases, ulcers can lead to nausea, vomiting, feeling full after eating only a small amount. When ulcers begin to bleed, symptoms become much more dangerous. Vomiting that resembles coffee grounds or the presence of black tarry stools indicates internal bleeding, a medical emergency. Chronic bleeding can cause iron deficiency anemia, with symptoms like fatigue, dizziness, and pale skin. Before we continue, if you've been finding this video helpful, hit the like button and don't forget to subscribe and turn on the bell icon so you don't miss more videos like this. Treatment of ulcer. Treating an ulcer involves more than pain relief. The goal is to stop tissue damage, eliminate the root cause, and prevent dangerous complications. If H. pylori is detected, doctors typically prescribe a combination of antibiotics to kill the bacteria, a proton pump inhibitor, PPI, to reduce acid production and promote healing, Common PPIs include omeprazole and lansoprazole, which are usually taken for several weeks. Even if an ulcer isn't caused by H. pylori, acid suppression remains essential. This may involve H2 receptor antagonists like ranitidine, although PPIs are generally preferred for their stronger effects. Antacids may offer short-term relief but do not heal ulcers or address the underlying cause. Another medication, sucralfate, may be prescribed. It forms a protective coating over the ulcer to shield it from acid. If the ulcer is caused by NSAID use, stopping a medication is crucial. However, this should always be done under medical supervision, particularly for those using NSAIDs for chronic conditions. In such cases, doctors may suggest alternatives or add protective drugs. Surgery is rarely needed today thanks to modern medication, but in cases of bleeding, perforation, or obstruction, surgical intervention may be necessary. Bleeding ulcers can sometimes be cauterized during endoscopy, but if the bleeding is uncontrollable or if a hole has formed, emergency surgery is the only option. These complications are not rare. They are often the result of delayed diagnosis and treatment, a consequence of misinformation or neglect. Diagnosis of ulcers. Diagnosing an ulcer involves more than just discussing symptoms, as they often mimic other gastrointestinal conditions. Doctors use specific tools to confirm both the presence and location of an ulcer. The most accurate method is an upper endoscopy. During this procedure, a flexible tube with a camera is inserted through the mouth into the stomach and small intestine. This allows doctors to directly view ulcers and take biopsies, especially to test for H. pylori or rule out stomach cancer. Less invasive tests for detecting H. pylori include urea breath test, stool antigen test, blood antibody test. While these tests can confirm the bacterial infection, they don't show the physical condition of the stomach lining. Imaging studies, like X-rays with barium contrast, may reveal larger ulcers, but they are far less sensitive than an endoscopy. Because ulcers can bleed or become cancerous, accurate diagnosis is essential, not only to relieve pain, but to prevent serious, potentially fatal complications. A crucial but often overlooked diagnostic step is reviewing medication history. Patients who regularly take NSAIDs or corticosteroids must inform their doctor, as these significantly raise ulcer risk and complicate diagnosis and treatment. Suddenly, many people take over-the-counter painkillers for years, unaware of the internal damage. By the time they seek help, the harm is often extensive and harder to reverse. Ulcers are not minor irritations. They are open wounds that can lead to internal bleeding, infection, and long-term organ damage. While they are usually treatable, the real danger lies in waiting too long. Every year, thousands of people suffer avoidable complications because they ignored symptoms or masked them with painkillers. The signs of an ulcer are clear. Burning stomach pain, nausea, weight loss, and dark stools should never be taken lightly. Once an ulcer forms, it doesn't simply go away. It deepens, spreads, and weakens the stomach or intestinal wall. If you wait until the pain becomes unbearable or bleeding begins, you may already be in a medical emergency. Early diagnosis and treatment aren't optional, they are life-saving. Understanding how ulcers form, how they present, and how they can be treated is essential, especially if you have risk factors like chronic NSAID use, smoking, or previous H. pylori exposure. Don't assume it's just heartburn. Don't wait for it to pass. The damage may already be occurring, and the longer you delay, the more dangerous it becomes. Ulcers kill quietly, but you can stop them if you act early. Let us know your experiences or thoughts in the comments below, and thanks for watching.